Meet Sarah. Dr. Dan has just confirmed she's pregnant. On her way out, Sarah stops by Receptionist Rita's desk to book her first ultrasound. Receptionist Rita is overjoyed. 5 o'clock rolls around and Receptionist Rita heads home, excited to share the news with her hubby. Unable to control her excitement along the way, she shares the news with local grocer Grant, painter Pat, server Sam, and the list goes on. Before Rita reaches home, nearly everyone in town knows about Sarah's pregnancy. Everyone but Sarah's sweetheart, Sal. What's wrong with this picture? By sharing Sarah's news, Receptionist Rita has violated Sarah's privacy and the Personal Health Information Protection Act. Whew, what a mouthful. Let's refer to it as PHIPA from here on out. PHIPA sets out the rules for the collection, retention, use, disclosure, and disposal of personal health information. Breaches of privacy can happen quickly and unintentionally. It is your responsibility to know about and adhere to PHIPA. In order to protect your practice, yourself, and your patients, you need to know all about consent, implied consent, assumed consent,
information practices, HIC,
circle of care,
agent, violations, assumptions of validity, access to information, rights, responsibilities, disposal, disclosure, retention, research, regulations, consequences, fines, risks, harms,
and breathe. I know, it's overwhelming. Don't worry, we will go through this together. Let's start with identifying who PHIPA applies to. PHIPA applies to individuals and organizations referred to as agents and health information custodians, or HICs. HICs are individuals or organizations with control over personal health information. These may include hospitals, psychiatric facilities, pharmacies, laboratories, nursing homes, retirement homes, and long-term care facilities, community care access centers, ambulance services, boards of health, and the Ministry of Health, among others. HICs also include healthcare practitioners such as doctors, dentists, pharmacists, psychologists, nurses, and other healthcare professionals. Lastly, HICs may include prescribed entities like Cancer Care Ontario, the Canadian Institute for Canadian Health Information, the Institute for Clinical Evaluative Sciences, the Pediatric Oncology Group of Ontario, and more. The group of people authorized by an HIC to collect, use, disclose, and dispose of personal health information that are actively involved in providing direct health care to a patient are referred to as agents. That's you, and others including surgeons, residents, nurses, technicians, clinical clerks, and other employees assigned to assist in the care of the patient. It does not include this guy. Now, there's another term not officially recognized by PHIPA, but important for you to know. It's the circle of care. It refers to those in a healthcare team who are actively involved in providing direct healthcare or follow-up treatment to a specific patient. These healthcare professionals are permitted to rely on the patient's implied consent when collecting, using, disclosing, or handling the patient's personal health information. For example, Sarah's circle of care might include the technician who carries out her ultrasound, the lab staff who takes her blood samples, the physician and nurses who help deliver her baby, and her family physician. 6 conditions need to be met in order to properly disclose information to a member of the circle of care. 1. The HIC must be entitled to rely on implied consent. 2. The information being disclosed must have been provided by the patient, his or her decision maker, or another HIC. 3. The information was collected for the purpose of providing or assisting with healthcare for the patient. 4. The information received from one HIC to another must be for the purpose of providing healthcare to the patient. 5. The disclosure of information must only take place between HICs. And 6. The HIC providing the information must not be aware that the patient had withheld or withdrawn consent to the collection, use, or disclosure of their personal health information. Now that you know who and who isn't affected by PHIPA, let's talk about what it protects. The Act protects personal health information. Personal health information, or PHI, is identifying information about a patient's health and healthcare history. This includes physical and mental condition, family medical history, provision of healthcare, long-term healthcare services, health card number, blood or body part donations, and payment or eligibility for healthcare. PHIPA defines guidelines for the collection, use, and disclosure of PHI. The rules pertaining to collection are: PHI must be collected directly from a patient or an authorized decision maker, and no more information than necessary to perform the required healthcare may be collected. And now for how. PHIPA protects personal health information by upholding the patient's rights and ensuring the responsibilities of the players are met. Psst, that's you. Patients have the right to know the purpose for the collection, use, and disclosure of their PHI, to refuse the collection, use, or disclosure of their PHI, to withdraw consent, to request access to their PHI, to place a complaint with the Information and Privacy Commissioner about any breach of PHIPA, to request corrections to their PHI, and lastly, to request that part or all of their PHI be made private. Now on to your responsibilities. In order to stay out of trouble and protect patient privacy, PHIPA asks that you obtain proper consent where necessary, collect PHI lawfully, take precaution to safeguard PHI, ensure accuracy and upkeep, ensure proper and safe storage, assign a PHIPA spokesperson and share their contact information, post public notices on information protection practices, inform patients of non-consensual use and disclosure of PHI, and ensure relevant persons are informed of their PHIPA responsibilities, like we're doing right now. Before we go any further, let's talk about those details of consent. Consent must be knowledgeable, voluntary, not obtained through deception, and directly provided by the patient or an authorized decision maker. There are two types of consent: express and implied. Express consent, which is explicit, meaning either verbal or written, is required when information is disclosed to an individual or organization other than an HIC, disclosed between custodians for reasons other than healthcare provision, or used for fundraising, marketing, or research activities. On the other hand, implied consent may be assumed and is applicable in cases where it is believed that an individual would reasonably agree to the collection, use, and disclosure of their PHI. Remember Sarah and Sal in their story of spoiled surprises? Receptionist Rita violated PHIPA by letting her excitement get the better of her. She committed a breach of privacy. A breach of privacy occurs when PHI is collected, used, disclosed, or disposed of in a way that is not compliant with the Act. Privacy breaches vary in severity depending on whether actions are carried out in carelessness, curiosity, concern, or personal gain or malice. Consequences range from warnings, suspensions, and fines to termination and legal repercussions. Individuals harmed by a privacy breach have the right to sue for damages. Breaches of privacy are not taken lightly, and repercussions are severe. Fines can reach as high as $250,000 and may be directed at individuals and/or their respective organizations. Another important responsibility that you have as keepers of PHI is to protect the security of the information you collect. This ensures the security practices of your organization do not allow for breaches to occur. Remember, you can have security without privacy, but you cannot have privacy without security. Follow these simple 7 rules to maintain your personal PHIPA compliance. Number 1. Trust your instincts. Do not open emails with web links or attachments from unverified sources. Use common sense. Keep your login credentials to yourself. Number 3. Mind your devices. Your computer, phone, and tablet contain valuable information. Take every precaution to safeguard them, and never leave your device unattended in a public space. Number 4. Remember privacy first. Keep sensitive data encrypted. Ask your IT guy or gal for help with this one. Number 5. Keep it clean. A clean desk policy is always best. Always log off and lock up, shred sensitive documents, and keep your desk clear of any PHI when you are not around. Number 6. Apply the need to know policy. You should only have access to the information required to complete your job tasks. And lastly, number 7, lock it up. Use strong passwords and never use the same one twice. A good password should consist of a combination of upper and lowercase letters, numbers and special characters, at least 8 characters long, and changed every 90 days. Remember your IT guy and gal? Contact them immediately if you think your password has been compromised. Patients are depending on you to protect their personal health information. It is professional, respectful, and the right thing to do. By following PHIPA, you are not only protecting your patients, but yourself and your organization as well.